This is the patient which are recovered from the COVID-19 pneumonia and now presenting the new types of symptoms and complaining the vision loss of from the left eye and periorbital swelling. And these are the MRI of the plane plus contrast of PNS and brain and orbit. Okay, and this is the left maxillary sinus mucosal inflammatory thickening which appears iso-intense on T1, and this is T2 weighted sequences. This mucosal thickening shows iso to hyper intense on T2 weighted, and this lesion shows subtle diffusion restrictions on high B value more than 2000, on B value of more than 2000, and this is the post contrast images and heterogeneous enhancement of this mucosa. We can notice here this maxillary sinus mucosa and this sphenoidal mucosa which are not enhancing on the contrast study. This is the infected and dead tissue. Okay, so this rhino-mucormycosis causes damage of the inflammatory tissues, and this is the very invasive sinuses. So we can see this is the optic nerve. This is the optic nerve which are enhanced on post contrast study and also appears hyper intense on T2 sequences. These are the optic nerve which shows contrast enhancement, and this fungal extended pre-antral area. You can see this is the pre-antral area and involving the pre-antral region, and it also extended along retroantral area. This is the retroantral area which are also appears inflamed and thickened. Now this fungus also extended bilateral cavernous sinus and causing bilateral cavernous sinus thrombosis. Intracanalicular extension of the inflammatory tissue through the roof of the nasal cavity, and posterior wall of the frontal sinus. Associated enhancement of the meninges in left supraorbital and olfactory recess. Associated meningeal enhancement we can also notice here.